Hi, I'm Dr. Esther from Cambridge Cat Hospital here again with our other clinic cat, Mouse. I'm going to let Mouse down. Today we are going to cover the annual checkup and physical exam. As you probably know, us vets, we recommend that you bring your cat in to see us at least once a year. More often as they get older, probably above the age of anywhere between 8 and 10, we might recommend that they come in even more than once a year. And during that visit we cover lots of different things, like we'll discuss nutrition and dental care and certainly any health problems. Today my big focus is going to be on the checkup, the physical exam. I'm going to guide you through that. So I start my exam by watching Mouse move around the clinic and seeing, getting an idea of her general appearance, how do her skin and coat look as she walks in the clinic. Does she walk normally? Does she interact normally with her environment? It's normal for a cat who comes into the clinic to be a little stressed and nervous. Does she seem bright and happy in her eyes? Or sometimes they'll be angry with us, which is just part of cats. Okay, now I'm going to pick Mouse up and we're going to start the actual hands-on exam with her weight. Okay, and she's 11.6 pounds today. And then I would write that down and compare it to her previous weights in the chart. If she's gaining weight and is becoming overweight, we will discuss strategies for weight loss. If she's got unexplained weight loss, that can be a sign of illness, and it's definitely something that we're going to want to address. So now I'm going to start my head to tail physical exam. I start by having a nice look at Mouse's eyes, looking for nice, normal, shiny corneas, no redness or inflammation of the conjunctiva, no abnormal eye discharge. And then I lift her lip and have a look at her teeth, looking at her, all of the teeth in her mouth, running my hand along either side of her mouth so that I see her canines and her molars. I open the mouth and look inside the mouth at the back of the throat. And now I've got my fingers under her chin and I'm feeling her submandibular lymph nodes. I'm going to have a look inside her ears for signs of abnormal ear discharge, abnormal redness in her ears. So that's most of the head exam. Now I'm going to move on. So as I move down, I'm feeling all of her joints and just getting a general feel of her body. Then I'm going to listen to her heart and lungs. And her heart is nice and normal. No abnormal heart murmur or abnormal heart rhythm. The heart is one of those things which can change as pets age, so it's something we're going to be wanting to check at least once a year. Have a listen to her lungs. They're sounding nice and clean and clear. And then I'm going to perform a gentle abdominal palpation where I'm able to feel her internal organs like her kidneys and her liver, and I can feel for lumps and bumps. Like occasional animals, older animals will develop masses in their abdomen. That's something that we can often palpate. And then I get to her tail and bum area, have a look back there, palpate the lymph nodes in the back of her legs, evaluate her skin and coat. It's looking nice and shiny. Look for fleas or any other parasites. Occasionally we could see ticks. Around her bum I will look for things like tapeworm segments, which could indicate a tapeworm living in her intestines. And that's pretty much it. During that exam, as you saw, it's relatively quick, but I'm absorbing a tremendous amount of information about Mouse's condition, and I will review all of that with you at the end of our visit. Thanks so much. In future segments, we will discuss things like specifics of nutrition, specifics of dental care, specifics of parasite prevention. So stay tuned in.